Today's video is sponsored by ZocDoc. Outside barbecues, hiking, running around in the grass, it's all fun and games until that mystery bug bite keeps getting worse and worse. I had one that turned purple once. Best to see a professional about that. And that's easy peasy with ZocDoc on your side. ZocDoc is a free website where you can easily search and compare high-quality in-network doctors so you can find the right doctor for you. Whether you're looking for someone in-network, nearby, or with specific appointment times, ZocDoc helps you quickly find the right doctor for your needs. No guesswork, no phone calls needed. Appointments also happen fast, typically within just 24 to 72 hours of booking, even booking same-day appointments with just a few clicks. Plus, with tons of verified patient reviews and detailed doctor profiles, you can get a real sense of the provider and their practice before you ever step into the office. And ZocDoc isn't just for one type of care. They have more than 100,000 providers across nearly every specialty, from primary care to dental health, eye care to skin care, and much more. It's the one-stop shop for all your healthcare needs. Plus, it's completely free. Be kind to yourself this year. Using ZocDoc is free. Visit ZocDoc.com/amyk to find and instantly book an appointment with a top-rated in-network doctor today. And with that, thank you so much to ZocDoc for sponsoring this video, and let's get on to it. Hi there. Just taking a look at your chart now. Sorry, just one moment. If you don't mind, just gonna take a look. Alright. Let's see, that's just, and then it's okay. And then the nurse, she saw you. You spoke to the nurse. Okay. So just going through your chart. Okay, she took your blood pressure. She wrote down some notes. Did you give her, did you tell her, are you allergic to anything? Okay, I'm just gonna double, I don't see it here, so I'm just gonna write that down. Okay. Yeah, sorry, just gonna make sure I get everything before we really start getting into everything. Okay, so I got that. And I was just curious, so what medications are you currently taking? What current medications? Okay, and that's the generic. Yeah, okay. And what do you take that for? What is the reason you take that? Okay. Any other medications that I should be aware of? Okay. Okay. Yeah, thank you. I just wanted to get everything. And your first and last name is to the check. And can you spell your last name for me, please? Can you spell your first name for me, please? Okay, good, alright. Perfect. Alright, so how about you go ahead and tell me a little bit about why you're here. Okay, goodness, I'm gonna put this hand sanitizer on my hands here before I touch your face. So I'm just gonna read these active ingredients here. So the active ingredient is ethyl alcohol, 70%, and let's just read the drug facts here. So just okay. Flammable, keep away from fire or flame. You aren't fire, so that's good. Okay, hand sanitizer to reduce bacteria on the skin, of course. Do not use it near the eyes. I promise I won't touch your eyeballs. Okay, rinse eyes thoroughly with water just in case. Okay. Store below 110 degrees Fahrenheit. Okay. May discolor certain fabrics or surfaces. Okay. Stop use and ask doctor if irritation or rash appears in last. Have you ever had a rash from use of hand sanitizer? Okay. I'm not gonna push on your face now. I just want to make sure that everything is safe here. I'm gonna put my gloves on. Okay, so continue. I'm sorry, before I cut you off, you were going on about what brought you here today. Okay, yeah. So we're a bit concerned about a growth on our face. Alright. And can you use your fingers to point at the growth? Okay. Yeah. So right here. Yeah. Okay. And tell me, how long have you had this growth that you can remember? Just about how long? Okay. Okay. Yeah. About your whole life? It's always been there. And so has it grown with you? Has it started small and gotten much bigger? Or has it always been the same size? It's kind of sort of grown with your face. Okay. Yeah, absolutely. Okay. So I'm just going to do a really quick check. I know that we've already gotten your blood pressure and everything, but I just want to just double check here your heart. Listen to heartbeat. Okay, we're good there. And I'm gonna get real close and have this behind your back. And go ahead and take a deep breath for me. 1, 2, 3, and exhale. 1, 2, 3. Good. Okay, and I'm gonna do the other side here, right on your back. Go ahead, take a deep breath. Inhale. 1, 2, 3. Okay. Good, and exhale. Okay, good. And lastly, I'm gonna get it right here in the front. Okay. And inhale for me, please. 1, 2, 3. Okay. And exhale. Good. 1, 2, 3. Good. Alrighty. That's good. Just go ahead and just keep this around my neck here. Okay, just in case we need that. And so what I'm going to do is I'm just going to take a look at it, and I'm going to touch your face, and I'm going to touch the growth as well. Is that okay? Alright. So I'm touching that, and is there any pain there as I touch? Is there any pain? Okay, what about if I touch right about here? Is there any pain? Okay. What about right there? Okay, just going to... Sorry, I didn't mean to move here. Okay. I just need actually. I'm just gonna use this actually to get a little closer look here. Okay, so see, there's no redness and all that. Does it cause you any pain throughout the day? some odd sensations. Alright. Can you explain those for me, please? Yeah, can you explain that for me? Okay. And it's primarily when you're breathing? Okay. Yeah, okay. And can you do your best to explain that for me a little more in detail? Okay. Yeah, alright. That's definitely very interesting. So if you don't mind, I'm just going to, because I'm kind of gonna poke and prod it a little bit to get a better understanding of what I'm dealing with here. So I'm just gonna use a sterile pad. It's like a little wipe. So this is isopropyl alcohol, 70%. It's an antiseptic. That's its purpose there. It's for external use only. Once again, it's flammable. We don't need to worry about that. Okay, so do not use with electrocautery procedures. Okay, we're not doing that. In the eyes. Okay, so if you experience any irritation or redness, or if you develop any conditions that persist for more than 72 hours, please consult me. I would be here, of course. Okay, I'm just going to do this up. And I'm just going to wipe the area. Make sure that it's nice and sterile. Okay. Okay. Just going to set this over here. So, and how does that feel? Are you feeling okay? Was there any stinging from the isopropyl alcohol? Just going to touch very gently. Very gently. I'm just going to touch. And very gently here. Okay. So did you feel any stinging at all? No? Okay. Good. Just going to. Alright. Are you feeling any pressure? If I put pressure, just a slight pressure here. Are you feeling any pressure? Okay, so once and again, I'm going to put a slight pressure here. Are you feeling any pressure from the slight pressure that I'm putting on your face here? Okay. Once more, I'm just gonna put a slight pressure on the growth here. Okay, and please tell me, are you feeling? Okay, so you do feel it, but is it sort of like once more? Okay, ready? Ready? One more time. Are you feeling an intense pressure, like a pain, or is it more just like I'm slightly pushing on the growth? Or do you feel potentially nothing at all? Like, what do you think? So, in comparison, I'm going to slightly push up here. Slightly push up here on your forehead so you feel that sort of pressure there. Yep. Let's do down here on your chin. So I'm going to slightly put some pressure down here on your chin. Okay, good. Now let's do that again. I'm just going to put some slight pressure here on the growth. Okay. Now, would you say that was equal to, more pressure, less pressure? About the same, just different? Yeah, okay. Absolutely. So, slightly, I'm gonna put this right here onto the growth here. So I'm going to use this too, just lightly, okay? I'm going to check down. Do you feel, when I do that, do you feel that at all? Okay, how about that? Okay, do you feel that right there? Okay, what about right there? Do you feel that? Okay, alright. I'm gonna put, okay, my tool right here. Do you feel that? Okay. Now I'm gonna put the tool right over here. Do you feel that by chance? Okay. How about right here? Do you feel that? Okay, good. And right here. Okay. And how about right there? Do you feel that right there? You feel that? Okay. Alright. Yeah. So that's not like okay. Yeah. So I have here. Just going to sanitize it really quickly. I'm just gonna do the same thing. I'm just gonna apply this to your face, and then you tell me if it's something that you are feeling, or if maybe, yeah. Just let me know, okay? So I'm just gonna apply this to your face. Okay, and directly onto the growth there. Okay, how are we feeling? How does that feel? Does it feel odd? Is it painful? Is it relaxing? How are we feeling right now? Okay. Are you able to go into detail about that for me? Okay, best you can, It's okay, it's not a test or anything. Okay. Alright, no, that's okay. Alright, okay. No, that's fine. I'm just gonna get an extremely close look here. If you don't mind, just gonna get an extremely close look to use this here. So these are Q-tips. So let's see here. So we have Q-tips, and it's like made of a cotton on the end. So it is a cotton swab, and is that okay? And there is also wood, just a regular sort of wood in the center. Is that okay? Okay, right. So I'm going to gently prod, okay? Okay. This here, so I get it there, so I can see. Okay, so any pain or anything like that? days would you say you wake up and you find that the growth is maybe red or inflamed? Okay, how many days would you say you wake up and you find that the growth is itchy? Itchy at all? Itchy scratchy? Okay, and is there any discharge from the growth? Not often, but there is. Okay, so tell me about those times when there is discharge. Okay, generally when you don't feel well, so when you're sick. Okay, any other times would you say that there's discharge? Okay. When you eat spicy foods. Okay. Anything else? When you eat warm foods. Okay. Can you describe the discharge for me, please? Spare no details, please. It's my job. Is that okay that I'm doing that? Okay. Okay, so it's like a thin, watery substance. Kind of salty. Okay. No, it's okay. Are there any other instances that you find that this growth has been discharged? Okay. When you get upset or emotional, yeah, that's okay. 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 Yeah, alright. Okay, so sometimes it's watery, sometimes it's more congealed, okay? Okay, so there was an instance where it was hit and blood came out of it. Okay, wow. Can you please tell me more about that, please? Okay, about how much would you say? Okay. And it stopped on its own, would you say? Yeah, okay. Okay. Yeah. Huh. Alright. Yeah, if you don't mind, I'm just going to. If you don't mind, I'm going to take this. It's a plastic cup. Is that okay? Okay, it's just a plastic cup. So it's a 16-ounce plastic cup. Okay. I'm going to place it over the growth. Okay, sort of like this. Okay. Okay, and I'm gonna do that again, and you tell me what sort of sensations that you are feeling. Okay, so I'm gonna take this. I'm just going to place it over your growth. Place it over your growth here. Okay. Okay, what are we feeling? What are the sensations that we're feeling right now? Okay, Okay, can you describe that Good. All right. Interesting. Okay. Okay, I'm gonna take that off of your face. Now, can you describe for me how you're feeling now? Better or worse than when I had this plastic up on your face over the growth? If you want me to do that again, I'm just going to slowly put that on the growth, okay? Okay, and off. Okay, one more time. Going to put it on the growth, okay? And slowly I'm going to take it off. One more time, okay? I'm just going to slowly put it on the growth. Okay, good. And I'm going to slowly take it off the growth. Okay, how are we feeling? Okay, so there was a bit of a difference there. Yeah, okay. Alright, yeah, so I'm just going to measure that real quick. The dimensions of the growth here, okay? So this is also plastic. This is here, so it's made in China. It's pink. Is that okay? I'm going to use that near your face. Okay. All right. I'm just going to 2, 3, 4. Okay. Okay. Get it real close if I can. Okay, I'm just gonna get this side here. So let's see, 1, 2, 3. When was the last time it was measured, would you say? Okay, so you've actually never gone to the doctor about this, okay. Yeah, no, it's fine, it's fine. One, okay, and just no doctor has really mentioned it all, brought it up, or anything like that during any of your normal, your general practitioner never really brought it up during your normal visits or anything like that? No? Okay. Yeah, of course, I'm a specialist, absolutely. Yeah. Okay, I'm just going to look at this side here. It's just 1.5. Okay, I'm just going to get this part right here, okay? It's okay. I'm going to write that down really quickly. So, grab my, just write down some of this. Okay, just going to do a quick drawing of the growth here. Okay. Map out the So, are you looking to get the growth removed, or are you fine with it? It sounds like it's not giving you any issues. So, yeah, okay. If you don't mind, I'm going to look up inside the growth. Okay. Okay, just stand very still for me. Okay. Alrighty. Yep, it is a little bit more sensitive. Yep, okay. That's okay. Yep, that's very normal. Just hold very still for me. Okay. So I'm not seeing any wounds or inflammation or signs of infection or anything like that, thankfully. Yeah, very good. Okay, right. And these two cavities have always sort of been on the growth, or have they over time gotten bigger? Okay, so you've always had both of these cavities on the growth. Okay. Okay. Yeah. Okay. And if I close up one of these cavities, how does that make you feel? Okay. And what about if I close up this other one here? Okay. So, and if I open them up a bit more like this, how are we feeling? Okay, take a deep breath for me, please. Take a deep breath. Okay, good. One more, please. Take a deep breath. Okay, and out. Okay, good. All right. Okay. So I'm just gonna take this off here. So for today, so what brought you in today? What is the reason as to why you thought maybe you would get treatment for the growth today, as opposed to every other day of your life? Okay, so you just sort of woke up and realized it had been there the whole time. Yeah. Okay. And we're taking all of our medications regularly? Yeah. I think we might have to, I think I'm going to refer you to a specialist to take a look at your brain. So your growth is actually your nose. Do you know what I refer to when I say that? Do you know what a nose is? Yeah, okay, so that is actually your nose. It's a very normal human nose. It's very, very standard, very common, I would say, in looks. Yeah, so I would say that is in fact your nose, and I would not recommend that you get rid of it. I would say don't touch it in terms of surgeries or anything like that, at least not until we get your brain looked at, because I am concerned a little bit about your head. Did you have any head injuries recently? Okay. Yeah, so actually I have a specialist that I can refer you to. If you don't mind, we can have you take a look, or we can have her take a look to a bit of a cranial nerve exam sort of thing. Yeah, okay. So you were dancing, trying to learn a TikTok dance, and you maybe whipped your head back and forth a little bit too harshly last night? Okay. Yeah. Have you been, and it's okay, I'm not the police, you can tell me if you've been partaking in any drugs or alcohol recently. Once again, I'm not gonna snitch you out, I'm not the police. Okay. Alrighty then. That could actually be the cause. Yeah. So yeah, no, I'm just gonna have my specialist come in and take a look at you. And I think I'm actually gonna get you something for what you just mentioned there. It sort of will help you sort of calm down. Okay, so you're gonna feel really calm soon, okay? And we're gonna feel better. Okay, I'm gonna make sure that you feel better. Alright, so for now, I'm just gonna say get some rest. And get some rest. And everything's fine. Everything's okay. You are going to be okay. And everything's okay, alright?